You are listening to the global network of podcasters dedicated to the pharmacy profession. Welcome to the Pharmacy Podcast Network.
This is the Sex PharmD podcast with your host, Dr. Nadia Archambault, licensed clinical pharmacist and certified sex therapist. With a focus on women's sexual health and wellness, Dr. A is here to cover important health topics and answer all of your questions about subjects that can be applied to pharmacy practice. And now, here's Dr. A.
Hello, everyone. I am so excited to be back on Pharmacy Podcast Network. I am your host of Sex PharmD. My name is Dr. Nadia Archambault. I am also a certified sex therapist, so I am so excited to just be here and doing this again. I took a little hiatus, but I am back. So I wanted the first episode to be a review again of sex therapy. So what is sex therapy? So basically, sex therapy is talk therapy used for individuals or couples, and it can be related to a various number of things such as intimacy, sexual function, desire, communication between couples, or just the dynamics in a relationship. So no actual physical contact occurs in sessions. That's a big misconception. People aren't using sex toys in the session or anything like that. It's simply just talk therapy. I consider myself a coach, so it doesn't limit my practice. And I've been seeing patients via telehealth for the most part. And it's been very rewarding for me. Given I had a history with compounding pharmacy, talking to a lot of individuals about hormone replacement therapy, low libido medications for both men and women. So this kind of combines everything that I've done in my pharmacy practice. And I really love doing it. It's extremely rewarding for me. And I've seen individuals and couples really progress and change. So as far as specific things that I've talked about with couples or individuals, so first individuals. So sometimes an individual may come to me with low libido or sexual desire. I deal mostly with females on this, but there are males that I've seen in couples situations. And then as far as women's health goes, I've specialized in women who have vaginismus or pain via any type of insertion. I'm going to be doing an episode that's specifically dedicated just to that. There's also anxieties that develop around sex, or just navigating your sexual identity or orientation. As far as with couples, there can be a lot of different things, such as communication. That's a big barrier, an emotional disconnection between couples, and that can cause issues around intimacy. And then also, women get older. We go through perimenopause, menopause, postmenopause. That's a big hot topic now. I'm going to be taking some deeper dives into that in some other episodes that can have an effect on your sex life for sure. So the first thing usually in a session, the first thing I do with patients is I go through what their chief complaint is, as we would pharmacists would look at it first. But basically, why are they there? I go through like their medical background, what their relationship status is like, what's going on there. The first thing I always ask them is, when was your last doctor's appointment for a physical, lab work, things like that. Sometimes that's something I need to review with patients, because that may be having an effect on their basically like For example, if a patient comes to me and they have low thyroid, that could be affecting your sexual desire and your libido. High cholesterol is another one. I've seen that a lot in males. And then, of course, hormones. So there's a lot of different factors that come into play. And then I like to also educate the patient, and that's a big part of sex therapy also. You're educating them on any information and anything related to their sexual health. And then I always give an individual or couples homework exercises. And that could be a whole different range of things. From one homework exercise could be schedule an OBGYN appointment and have your labs checked. That's your first order of business. For couples, it could be a communication exercise, things like that. So there's a lot of moving parts in sex therapy, which is why it interests me so much also. A big myth is sex therapy just for serious problems? The answer to that is no. Some people are already feeling pretty good in a relationship, but maybe they're seeking a deeper emotional connection or just feeling more confident overall. Maybe they're going through a life transition that they're navigating, so they need some help with that. And, as far as sex therapy goes, the biggest goal is to feel a sense of connecting again with yourself first, and then with your partner. So that's really the biggest takeaway with sex therapy. So just wanted to give a little rundown of what sex therapy is, or sex therapy one-on-one for our new listeners. For returning listeners, I'm going to be having some topics that we haven't talked about yet. And then I also wanted to just go through one of the first exercises I have someone do when we get through medical history background and things like that, is to do the love language quiz. There's different websites out there where you can do it. And there's 5 love languages. So we have words of affirmation, quality time, receiving gifts, acts of service, and physical touch. I think they should add a 6th one, which is personal space. I think some people really value their alone time. That definitely came about more so during COVID, when couples were home 24/7 around each other, and they needed some personal space. So I think that eventually they should add that one too. So words of affirmation, so that is through the spoken word, praise or appreciation. Some people are just needing that type of affirmation, and that's their love language. Quality time, giving that other person your undivided attention. Receiving gifts. So this doesn't have to be anything expensive, but it just receiving a present that shows thought, that shows you were thinking of them. Acts of service. This is doing a helpful thing, like, for example, filling up your partner's gas tank, or getting them their favorite coffee, or even just making them their favorite coffee. It's not about, with the acts of service, it's not about the money behind it. It's about the thought also behind it. And then we have physical touch. So physical closeness does not have to necessarily be sex, just maybe hugs, kissing, hand holding. The power of touch can be very powerful. So everyone has their primary love language. Is usually a primary and a secondary. So the thing that I tell a person to do is to take the love language quiz, because it helps them understand really how they operate, what makes them feel good as an individual. And then for couples, it's great because sometimes it's eye-opening, where they didn't realize the person, for example, was an acts of service love language. And this is interesting too. A lot of couples, so you'll tend to gravitate towards giving your partner the love language that you prefer. So for example, if your love language is physical touch, you're going to be touchy-feely with that person, thinking that's what they want too, because how could they not? Because that's something that is your primary love language. However, that may not be the case for them. And sometimes that often creates a feeling of rejection. So that's why it's important too to understand and know that other person's love language. So that's one of the first exercises and homework pieces I have individuals and couples do. So as you listeners, I would like you to complete the love language quiz, and it could actually shock you. I will post a link to get to the love language quiz in the show notes, so you have a good idea of where to find it, so you don't have to search all over Google. But that's one that I particularly really love to have other couples and individuals do. So I'm excited for a really interesting lineup of guest speakers that I have. I'm also going to have a segment where I rate a product, and I'll be dropping that little episode snippet as well. That's going to be before each episode. I'm thinking of calling it RX meter, but I love your opinion too. I was thinking farm or harm, but I think I like RX meter, so we might end up going with that one so I can rate it on a scale. I'll be taking a deep dive into different products that I've heard about, over the counter or prescription, related to sexual health and wellness. And I'll be giving my opinion and rating on it. So I think that might be helpful also. So I hope you all enjoyed this little mini episode introduction again, and I'm looking forward to having all of you listen in on some of the amazing topics and speakers that I have lined up for you. Hope you all have a beautiful day.